a randomized trial of progesterone in women with bleeding in early pregnancy. Definition: bleeding in early pregnancy is strongly associated with pregnancy loss. Miscarriage can cause excessive bleeding, infection, and complications associated with surgical treatment, as well as substantial psychological harm, including anxiety, depression, and post-traumatic stress disorder.
Bleeding in the first trimester is a common concern of many women, and may I reassure you that most of these are of no real problem to you. The main reason that you can bleed in the first trimester is something called breakthrough bleeding. Now, this occurs at the same time as your menstrual cycle will occur, and it carries on like little dust spotting until the hormone levels reach a certain level when it will subside. The second type of bleed is an implantation bleed, which is when the fertilized egg embeds into the side of the womb. And this just occurs one-off, and it's like slight spotting, but obviously of a concern to you. The third other type that's not really of anything to worry about is something called a cervical erosion. You might not even know you have this, but because the pregnancy hormones are at such a level that they cause the cervix to soften, during intercourse you might find you have this spotting. If you have any type of bleeding and you are obviously concerned, go along to your early pregnancy unit. There they can do blood tests and urine tests to check the pregnancy hormone levels. They will also do an ultrasound scan, and they can check for the fetal heart. This will help to reassure you that the other more serious concerns, such as an ectopic pregnancy or a threatened miscarriage, aren't going to happen.
Application in medicine. Progesterone is produced by the corpus luteum in the ovary. It is necessary to prepare the endometrium for implantation of the embryo. Additionally, progesterone is produced when an embryo implants in the endometrium and during early placental development. Progesterone is essential for the maintenance of the pregnancy. Several small trials have suggested that progesterone therapy may improve pregnancy outcomes in women who have bleeding in early pregnancy.
Hi there, my name is Dr. Dominic Rowley and I'm the Medical Director of Let's Get Checked. I'm here today to talk to you about progesterone. What is progesterone? Well, progesterone is a hormone produced in the ovaries. It has a number of functions, but one of its most important functions is to cause thickening of the lining of the womb, or the endometrium, to prepare the womb for a fertilized egg, i.e. to prepare the womb for a pregnancy. If the egg is not fertilized, the endometrium breaks down and a period occurs. So why get your progesterone levels tested? So one of the main reasons that our female patients ask for their progesterone levels to be tested is because of fertility issues. They may be concerned because they have unusual periods, or they may be trying to conceive, or they may have had difficulty trying to conceive, or they may have a complicated gynecological history and want their progesterone levels checked. So who should get tested? Well, as I mentioned, any woman trying to conceive. So if you've been having unprotected sex for approximately 6 to 12 months without any success. Also people who have complicated gynecological histories, for example, polycystic ovarian syndrome, or if you have a change in your bleedings, your menstrual cycles or your periods, and you're concerned generally about your gynecological health, then we would recommend that you get your progesterone levels checked. When is it recommended that you get your progesterone levels checked? Well, your progesterone levels are best checked 7 days before the onset of your menstrual cycle or your period. So for somebody who has a very regular cycle, i.e. every 28 days, we would recommend that you check your progesterone on day 21. So conversely, if you're not so regular, and for example you have your periods every 35 days, we would then recommend that you get your progesterone done on day 28. So if you have any doubts or queries about that, because it can be a little bit confusing, please contact Let's Get Checked and speak with one of our nurses, and they'll best advise you. What affects the reading of this test or the test results? So as I've spoken about, the test is best taken day 21. There are also some other factors that may affect the reading of this test. For example, if you're having your period, that will affect the reading of the test, the time of day the test is taken, if you're taking fertility medications such as clomiphene, and some other medications. But again, if you have any doubts or queries, please contact one of our nurses through Let's Get Checked and they'll best advise you.
Pros and cons. Pros. Progesterone prevents miscarriage in asymptomatic women who have a history of recurrent miscarriage. Progesterone rescues a pregnancy in women who have started to bleed during early pregnancy. Cons. Treatment with progesterone didn't result in significant improvement in the incidence of the live births among women with vaginal bleeding during the first 12 weeks of pregnancy.
10 to 25% of all clinical pregnancies will end in miscarriage. The most common cause of pregnancy loss is chromosomal abnormalities, which means something is just not right with the baby's DNA. This type of loss is not preventable. Other common causes of miscarriage include hormonal problems, infections, and structural problems within the mother, and can sometimes be prevented. Your doctor can check your cervix and uterus for any abnormalities, screen you for clotting disorders that can prevent implantation. Make sure you are current on all your vaccinations and check your hormone levels. Diabetes, low thyroid, and low progesterone can all cause pregnancy loss. Things you can do at home to prevent miscarriage include 1. Not smoking, drinking alcohol, or using drugs. 2. Maintaining a healthy weight and keeping diabetes under control, and monitoring your progesterone levels with urine progesterone test strips.
Issue applying Ecuador. It is necessary to continue evaluating this pharmacological treatment to implement it in Ecuador because there is no evidence to support the indication routine of a progesterone in prevention of miscarriage in the first half of pregnancy. However, there seems to be evidence of benefit in women with a history of recurrent miscarriage.
Well, it's something that most women don't want to talk about, but as many as half of all pregnancies end in miscarriage. Celebrities, including Beyonce, Pink, Gwyneth Paltrow, Gabrielle Union, Michelle Obama, and more, have opened up about their miscarriages. Many women who suffer a miscarriage fear it could happen again, but there may now be some hope. WCNC Charlotte's Ashley Daly reports what could prevent thousands of miscarriages every year.
Well, at the end of the day, for so many women, this right here is the dream, to have a healthy, beautiful baby. But for 1 in 4 women, their pregnancy will end in miscarriage.
We did 6 IUIs, and we did get pregnant on the 6th IUI, but sadly ended in a miscarriage at 16 weeks.
In an interview last year with WCNC Charlotte, Lauren Bassett described the heartbreak she felt when she and her husband learned she had miscarried and their twin baby girls were gone.
I don't think it's something I'll ever get over.
Lauren is not alone. Data shows nearly half of all pregnancies end in miscarriage, and some women will experience more than one.
Almost any woman you know who's had at least 3 babies has had at least 1 miscarriage.
Dr. Hubbard is a board-certified OBGYN. I sat down with him at his practice in Rock Hill to discuss the results of a new study, which claims progesterone injections could help prevent miscarriages. The study involved more than 4,200 women and found progesterone treatments increased live births by 5% for women who've had 1 previous miscarriage and by 15% for women who've had 3 or more.
It's neither good nor bad. It's still cautionary.
Dr. Hubbard says a woman's body normally produces progesterone throughout a pregnancy, but when it doesn't is one of many reasons doctors say a pregnancy could end in miscarriage. The theory of this latest study was to give progesterone to women who weren't producing enough.
The problem is that miscarriage can be caused by a lot of different reasons.
And while Dr. Hubbard says more research is needed, he also says there's no harm in trying. He says progesterone is safe for both mom and for baby, and he also says it costs roughly $200, making it an affordable fertility treatment for even those without insurance. Ashley Daly, WCNC Charlotte.
Conclusion. Before prescribing progesterone, it is essential to have established the correct diagnosis and based on this, indicate the correct treatment for each patient. To sum up, progesterone is indicated in women with a history of recurrent miscarriage because it significantly decreases the abortion rate.
First of all, I want to express my sympathies to you and tell you I am so sorry for the recent loss of your baby girl. My heart goes out to you and your family during this time, and I hope the best for you in the future. Now, you mentioned that you were getting progesterone supplements until about 15 weeks. You started spotting at 17 and then delivered your baby girl at 19 weeks. And you're wondering if you were still taking progesterone, if you could still be pregnant. Of course, I don't know the answer to that for sure, but there are studies that show that progesterone can prolong pregnancy and help a woman to stay pregnant longer, and it's often prescribed to women who have a history of preterm labor or birth. So next time you get pregnant, I recommend seeing a doctor. Let them know about your whole history, everything that happened last time and in situations before that. And chances are, because of your strong history of preterm labor and delivery, they will probably recommend progesterone. I sincerely hope the very best for you in the future. And if you have any more questions in the future, please don't ever hesitate to ask.